then take ECG, even if you take 100 times. Then another lady, she's a wife of a doctor. She came and said she has got breathlessness. We did everything. In fact, our cardiologist also saw her. We took ECG, echo, blood test, everything. It was normal. Next day, she came in a state of shock. Then, when we did other things, it found out to be subacute pulmonary embolism. And you know, subacute pulmonary embolism sometimes may not have any symptoms. When I asked the history, that lady had calf muscle pain. She has the history of venous thrombosis in the family. Her mother also had the same thing. Irony is, she had a calf pain, which we did not elicit. Her servant maid gave a good massage in the calf muscle previous day. You know, that made the dislodge the emboli, and then she developed, and you know, next day she came, we lost that woman. Only because we did not ask the history of DVT, and because we never thought about the family history. So subacute pulmonary embolism in the long run can lead to pulmonary hypertension or like this frank infarct. Then an young adult came to me with the history of some vague symptoms of numbness, and then when we examined, there was no neurological problem. And we just like that did the MRI, and MRI showed multiple sclerosis. So that day we thought multiple sclerosis should be your diagnosis, because NK Singh every day he sends some images. So you must think about this outside the box also. Sometimes, you know, multiple sclerosis, thank God, we started him on mycophenolate. Till now, touch wood, he is in remission. Then, see, a 52-year-old, my relative, my cousin brother actually, he's a textile mill owner. He called me around 11:30 in the midnight. He never called his wife. Said, Anna, please come. Bob Machan is not well. When I went there, he was in a state of shock, almost pulseless. Then I did CCR. I want to give a message here. Please do only CCR, cardio-cerebral resuscitation. Don't do CPR. You see, 90% of the cases where you have cardiac arrest, you must also take this to your CME groups. CPR should not be done. When you do CPR, you are wasting time. And when you do the pulmonary resuscitation, the blood circulation to the brain is affected. So 90% of the patient who falls has got only cardiac arrest, not pulmonary arrest. Only respiratory arrest needs CPR. Respiratory arrest will come in the drowning or poison or alcohol or foreign body. It is only in the picture you can see the hero will save the heroine in the drowning and give mouth-to-mouth breathing and romantic things. Every time it not happens. And no, nobody will do mouth-to-mouth breathing in a road. If a beggar or a roadsider, lies down, who will go do CPR? So they will hesitate. I tell you, 90% you do CCR, you can save the patient. Pulmonary arrest or respiratory arrest only in few conditions. And I saved that patient by doing CCR, and then he recovered. Again, he developed a problem. Then I gave DC shock. 2 times I gave, he did not. 3rd time I gave the DC shock, he recovered, and then he lived more than 28 years. And the scar, what I gave in the DC shock, was still there. He's a rich man. He gave a check, plain check, blind, said, you fill any amount. Then I said, no, this is only happiness. I don't fill. He lived up to 28 years after the shock. I feel very happy. Recently only he died. Friends, whenever somebody comes, as a medical council man, I'm telling you, a young boy came with fever. I admitted him in the hospital and gave paracetamol. I didn't even give any drip. At 8:30 in the night, after I admitted at 11 o'clock in the morning, the child became unconscious, the young boy. When I rushed, I found, he was unconscious. He's developing meningoencephalitis like picture. Then when I inquired, he had fever last week. He went to native treatment. He had a tayat in his hand. I did not notice all that. When I inquired, they said the tayat is because he had fever. He went and had mandram kati yendram. Then I told that person, sir, it's a brain fever. Then he asked me, why didn't you, sir, tell me earlier? Why did you admit him? I would have taken him to Coimbatore in a bigger hospital. I felt so bad. I sent him with the ambulance. I followed with the patient, doctor, and 3 days after that only he became conscious. Only then I was happy. Because, otherwise I would have felt bad. So, moral of the story, the lesson, any fever, anybody you admit, say it may turn out to be brain fever. It may be turned out to be something. So that precautionary, otherwise, you'll be in trouble. So this is one lesson I learned then before you do treadmill, see, always, we write, Balamurgan writes treadmill and his cardiologists do ECG, treadmill. Inquire whether he has got angina symptoms that day or previous day. Do a resting ECG. Don't do a treadmill without taking a resting ECG or getting the history. Once a person was sent to a cardiologist, my patient, he had some vague chest pain. They did a treadmill. On the treadmill, he developed infarction. So please don't do that. Check. Then, always aware of the local culture. I think all the diabetologists, Giri will agree with me. Here in Tamilnadu, there is a ritual called Pradosham. Pradosham, I don't know how many of you know. Ladies observe Pradosham. Pradosham means from morning to night they don't eat anything. And without knowing that, we gave injection, insulin continued. And she developed hypoglycemia. So understand the local custom. If Unnikrishnan in Pune, he must understand what is the local. Though he is a Keralite, he must know what is Pune, what is the culture there. Then treat accordingly. Then medico-legal case. You see, always a poison case, if you see, be careful. Once what happened, a young lady who is married, only 3 years married, up to 7 years is a medico-legal. Suicide death is a problem. They came to my hospital at midnight, 2 o'clock. I went and saw in the car, she was almost dead. I said, please take it to GH. Then GH, they found she dead. The police, deputy superintendent came next day, said, what is the observation? You only saw the patient. I said, I didn't see the patient. No, you only saw the patient before she died. You are the only person who saw. Unnecessarily, I was in soup because I have to give all the explanation. So, always, when you give a life certificate, don't give life certificate. Even if you give life certificate, don't give without date. And if somebody comes, a stranger, when you take a ECG, I took a ECG for a patient, it was infarction. I told him, it is infarction, you get admitted. He did not get admitted, he went out. In the corner of the road, he fell and he dropped down dead. And some ambulance, the TRAC dying factory fellow saw that. He took the same patient, brought it to me with broad dread. So I didn't know. I was there having only ECG only, no record. Till evening, nobody came. The police came, inquired. We did postmortem, all sorts of problem. So, ladies and gentlemen, the most powerful diagnostics tool is not technology. It's time and empathy. Listen more, examine deeper, and serve with greater compassion. When we truly listen to our patients, their stories, give the silence, will give so many newses. What do these stories tell us? Mistakes are not the end. They are the beginning of the mastery. Patients are not the cases. They are the teachers. Medicine is not perfection. It is evaluation. Let's be bold enough to accept our errors, humble enough to learn from our patients. Friends, you must understand patient. You should understand disease. You should understand drugs. One of the important wisdom I would like to share when people like Sanmugavel, Balamurgan, Ram Kumar, everybody is there. The lesson I learned, the wisdom I learned in my practice, have a balance between your academics, practice, relations, and health. I am not a good example because my wisdom, after I get this, I get addicted to your clappings and round of applause. And every day I don't go without shawl, without a memento. My sleep is not good until I see many people, hug many people, shake hands with people. this is not what you should do. I am a bad example. Because when you do all that, every day, if Unni Krishnan goes every town, his wife will scold, his practice will go down. And you know, and your academics is good, singing is academically good. But you know, his health, his practice goes. So I told Balamurgan, please balance. He is good. He always balances. He takes his wife some or other, give her a sari, give her gifts also, I know. So like that only you have to balance your life. First is personal health. Self-service is not selfish. Self-service is always good. Take care of your health.